Okay, so this is Friday, February 21st, 2020, and part of the reading for the Final Frontier MPTE course is the Blue Book. However, they don't have it on the timetable, but they have it in the reading folder. So I will go ahead and read this so I can practice some more with my recording program. So, an exercise tolerance test, ETT. It determines the physiological responses during measured and graded exercise stress of increasing workloads. The functions of the test is to determine the exercise capacity of the individual. It establishes an exercise prescription. It screens patients for possible cardio artery disease, coronary artery disease, and it assists in the diagnosis of suspected cardiovascular disease. The exercise tolerance test may be maximal or submaximal, depending on the patient's history and current symptoms. Submaximal is used to evaluate the early recovery of patients after a myocardial infarction, heart attack, coronary bypass, or coronary angioplasty. Lab test. Enzyme elevations. Diagnostic of myocardial infarction. Let's see if this one will get bigger. Yes. In which creatine kinase is elevated due to myocardial damage. Another lab test is the arterial blood gas test. If oxygen saturation is less than 88%, it requires submaximal oxygen. Normal oxygen saturation is 95 or above percent. Partial pressure of oxygen less than 80 indicates mild hypoxia. Partial pressure of oxygen less than 80 indicates mild hypoxia. PO2 of less than 60 indicates severe hypoxia and requires oxygen supplementation. Partial pressure of carbon dioxide is normally 35 to 45. Another lab test is a serum lipid test, and it's going to show your total cholesterol and your LDL levels. And elevated total cholesterol and LDL levels is associated with coronary artery disease. Cardiac rehabilitation phase 1. Inpatient cardiac rehab, acute, is usually less than 1 week for an uncomplicated myocardial infarction. The therapist interviews the patient, assesses a tolerance to physical therapy, and begins low-level activities if medically stable. The therapist is to monitor the pulse rate and the blood pressure during the treatment session. The goals would be to include the family and patient education, psychological support, progress to self-care independence, provide medical surveillance, and prevent deconditioning. Activities, you would do self-care ADLs that require 5 METs, selected arm and leg active range of motion exercises, very light weights, independent transfers, bedside sitting with progression to supervised ambulation and stairs at discharge. Exercise guidelines progress from 2 to 3 METs initially from 2 to 3 METs initially to 3 to 5 METs at discharge from the hospital. Short exercise sessions 2 to 3 times a day. And an exercise tolerance test may be used to determine functional capacity prior to discharge. Phase 2. Outpatient or home exercise program, subacute. Early at-home or outpatient management up to 3 months following discharge. Begins about 1 to 2 weeks after infarct or surgery. Gradual increases of intensities of activities within appropriate individual capabilities and medical limitations. Goals include independence and self-care, improve functional capacity, return to work or homemaking, modify lifestyle to decrease risk factors, begin low-level conditioning. Activities: independent self-care at home, walk, jog, or step aerobics program to tolerance. Other activities that range between 4 and 9 METs are indicated. Exercise guidelines: frequency, 3 to 4 sessions per week in duration, 30 to 60 minutes with 5 to 10 minutes of warm up and cool down. Discharge at 9 METs, functional capacity. Phase 3. Community exercise program post-acute. Usually begins 3 to 6 months after the incident and may last 12 weeks or longer. The cardiac team supervises the program that increases the exercise capacity and improves various physiological values such as blood pressure, heart rate response, cholesterol, and angina threshold. Goals: continued psychological recovery, individualized exercise training, promote long-term fitness, promote a lifelong commitment to risk factor modification. Activities: patient must function at a 5 MET level to begin program. Consists of aerobic exercises involving large muscle groups, walking, jogging, stepping, bicycling, swimming, rowing, etc. Low-level resistance exercises may also be included. Relaxation training may be part of the overall program. Exercise guidelines progress from supervised to self-regulated regulation of exercise. Progress to 50 to 85% of functional capacity, 3 to 4 times a week, 45 minutes or more per session. Termination from inpatient exercise session. Certain signs and symptoms indicate a patient is not tolerating the level of activity prescribed. Careful monitoring is necessary to ensure that the level of intensity of exercise is appropriate for the patient. Criteria that further diagnostic evaluation and changes in the exercise prescription are indicated. Fatigue, lightheadedness, confusion, ataxia, polar, cyanosis, dyspnea, nausea, or onset of angina with exercise. ST displacement, 2 millimeters horizontal or downsloping from rest level. Ventricular tachycardia or 3 or more consecutive PVCs. drop of systolic blood pressure more than 20 during exercise, rise in systolic blood pressure more than 220, or diastolic pressure to more than 110. Cardiopulmonary resuscitation technique, 2005. I'm pretty sure that has been changed since 2005. I'm not even going to read that. Okay. So, what is METS? What is METS? Let's go to the library. See if we can find it in here. ETS. I'm going to search for it. Calculation of MET. MET is the ratio of the rate of energy expended during an activity to the rate of energy expended at rest. 1 MET is the rate of energy expenditure while sitting at rest. That's not telling me what I want to know. Okay, so let's try a different book. Let's try this one. Let's see what happens. Not finding what I want. All right, well, I can't find it in my library, so maybe it's in a book that I don't have. I have one book in Chegg that I never bought, out of Chegg. So I'm going to stop this and go look for it.